Hi, everyone. So, next speaker is Dr. Amir Rahmani. He's a professor of nursing computer science at the University of California, Irvine, where he holds the Samueli Endowed Chair of Integrative Health. He serves as the co-director at the UCI Institute for Future Health and leads the multidisciplinary HealthSciTech Group at UCI. His research spans mHealth, data science, wearable and mobile computing, machine learning, and magnetic AI, affective computing, and biosignal processing. Dr. Rahmani's contributions have been recognized with the UCI Beall Applied Innovation's inaugural Faculty Innovation Fellowship, the Nokia Foundation's Research Excellence Award, and the European Union's Global Marie Curie Fellowship. So everyone give it up for Dr. Rahmani.
Thank you so much for the nice introduction and having me. Let me quickly share my screen and get started. So thank you again for having me today. It's really an honor. My talk is a little bit about future, of course, acknowledging all the concerns that we have and kind of considerations that we need to really take into account when building AI-based solutions, but just giving you also some sense of what potentials are there for us to kind of tap into. That's why I have this kind of topic of LLMs and how actually the world of wearable device and continuous sensing can be actually connected to the world of agentic and generative AI. So, but I would like to start with the notion of living labs because that's very connected to the type of research that we do at our center and also at the university. So, what is a living lab? Living lab is a real world research environment where technologies are developed and evaluated with users, right? In their, for example, naturalistic settings. And they really like move research out of controlled labs, where into really like real settings. And the idea is to really emphasize on user-centered co-creation, rapid iteration and learning, and kind of incorporating those learnings and to kind of improve the kind of, for example, intervention research or what any objective we have. And this is really critical these days in the context of especially AI because we really need to learn fast because especially due to the fast pace of technology kind of advancements. So I would like to give you an example, one example of a projects that we tried to do in living labs context. It was in the context of maternity care. We received a big grant from the National Science Foundation a few years ago to kind of build this living labs in a community-centered setting by collaborating with community organizations and trying to kind of better understand like and capture physical activity, sleep, stress, and some physiological signals of these pregnant mothers and help them to self-manage and have a more healthier pregnancy kind of period. And this really allowed us to understand like daily routines, stress, and so on, because we give these pregnant mothers, each of them like a smartwatch at that time, Samsung, and also a smart ring, Oura ring, to continuously capturing their heart rate variability, their sleep, and many, many other parameters. And also we designed a mobile app to collect self-reported outcomes, but also provide some sort of a digital intervention. It was a personalized exercise recommendation tailored for pregnant mothers. And the idea in this research was, as you may know, ACOG recommends at least 150 minutes per week of moderate intensity aerobic activity. But that sounds simple, but terms like moderate intensity, aerobic activity are abstract to many people. And people also have different like kind of baseline levels. Some are highly active, some of them have a very sedentary kind of a behavior. So the idea was, can we design a personalized recommendation engine powered by AI that can help turn static recommendations into more like actionable day-to-day or in our scenario, week-to-week kind of support because we were trying to really tailor that. So this actual diagram shows how we close the loop between the patients and clinicians and AI. And the process starts with the nurse providing an initial exercise recommendation. And the mother then follows like this personalized regimen while wearables and survey continuously capture both self-reported and objective outcomes and also making sure safety is there, for example, because let's say a pregnant mother's heart rate, for example, should not go above a certain threshold. And this data was then used to train an agent for us to kind of learn each individual's responses to different exercises. Like some people really needed a more rigorous activity to get to that moderate zone. Some people really like with a easier kind of regimen could get to that level. So that was really kind of the idea how we can capture all this in real time and every week tailor that recommendation to these individuals. This was more or less a pilot study, proof of concept, more NSF type of project than NIH, to really kind of look at the technology and its potentials. And the slide actually shows the outcomes over this 12-week period that using this intervention. And overall, actually, the exercise during this intervention, this 12-week intervention, almost doubled. And also not only the duration, but also we saw like a meaningful shift toward like healthier, light to moderate kind of intensity activity, almost like 64% gain, I would say. The papers are cited here. I encourage you to look at those offline. But one thing, this is just one example. We have had a lot of different studies, for example, on loneliness of, for example, college students, on depression of elderly and dementia caregivers. So these are just all the examples that can show that we can these days run studies in everyday settings thanks to like technologies like wearable and portable devices, mobile phones, and many, many other remote sensing and intervention technologies. As part of all these activities, actually, in 2022, we finished building an academic platform at that time called Zotcare to kind of really was an infrastructure to implement quickly and prototype these kind of digital interventions fast. And the idea was like having a flexible platform that brings everything you need to run a human study in real worlds into one place, like smart, like sensors, smartphones, and cloud infrastructure, and so on. And not without, the idea was actually do it without any coding. So you don't want to reinvent the wheel for every study because many of these studies, regardless of the population, they share a lot of components, similar components. For example, device integration, EMA collection, all these things, or certain digital interventions that would help, would basically support behavior change. And that's actually when we recently even turned this into a kind of a service that everyone, even outside our center, can use it with the help of our UCI Beall Applied Innovation office. So now this platform is called Center Alive, and I encourage you to check it out. It's available to everyone who wants to build their own living labs. We have already integrated a lot of different devices with high resolution access to research data, like interbeat intervals for HRV analysis, sleep, actigraphy, everything. But also at the same time, you have like all-in-one dashboard where you can build your EMAs, schedule them, have automatic reminders if they forget to fill it out, even have a simple studio that you can build your own interventions, not only scheduled interventions, but also just-in-time interventions. Actually, Center Live is the only platform which allows you to, for example, trigger an intervention based on the data coming from a sensor. For example, you only send out sleep hygiene intervention following a night of poor sleep quality detected, for example, by Garmin or Aura or something like that. And of course, you're also going to have this all-in-one comprehensive dashboard to look at the adherence to all of these components. But now I would like to shift the gear a little bit because I promised to talk about some of our activities in the agentic AI space. And this is about, in fact, in 2023, when agents were not that popular, and LLMs were kind of the big hype at that time, really started to making the case that we need to go beyond these offline static large language models to really kind of be able to realize what we really need in the field of healthcare, and especially in the field of mental health. The idea is that, care is continuous, contextual, and safety critical. And we can't just rely on, models, memory, agent, and anything like the pre-trained information that they hold. But agents, what they do, they can actually integrate external knowledge, external data, external models. And that knowledge can be, for example, you can limit your model or chatbot to really kind of follow clinical guidelines, like use specific patient data, for example, data that is coming from their wearables, and up-to-date evidence to provide, to improve safety and mitigate hallucination. And the other idea is that agents actually maintain the state. That's very important. They maintain the state of the conversation and guidance over time and adapt to changes, and they can also escalate to clinicians when needed. So the platform that we built at our center is open source, and I encourage everyone to check it out. It's called openCHA, or Open Conversational Health Agent. If you visit openCHA.com, you can actually access to everything, all the training materials, code, source code, everything. And the idea is that this platform allows you to connect your LLM, regardless of what LLM is, from OpenAI, your own Llama model, or anything. You can empower that and build an agent around it by connecting it to the external sources. For example, you have already a model for maybe an NLP model for a specific, maybe emotional recognition, or you can connect it to certain knowledge, maybe a knowledge graph or knowledge base by or clinical guidelines that you have curated for your own clients or research, as well as the data. For example, in this scenario, we have integrated the agent to the centralized platform, using which it can access in real-time data of that person's, like, for example, sleep, anything that the data can be captured from those devices, and actually really brings us to the title of the talk, which was like from wearables to LLMs. Now the LLM can actually see every moment and analyze your sleep quality, your, for example, emotions and everything, rather than just giving you generic advice. It can, tailor that towards your needs, and what, we know at the end of the day, each of us are really unique. openCHA, just to mention, is being standardized by HL7, and IEEE. We have had a lot of workshops. They are recorded they are available on our website as well. But I would like to finish. This is actually my last slide. I would like to show you just a 2-minute demo, a very high-level demo of how, for example, an agent can tap into external knowledge and data to provide personalized answers. So let me quickly switch to my browser, because I would like to share audio with you. And this video is also, as I said, it's on our website, openCHA.com. And let me start from here, when you can, just for the sake of time, I'll do fast forward. Please let me know if you cannot hear the audio.
From the user. Let's start by asking the agent to show my personal nutrition effects on a specific health outcome, such as deep sleep. To do this, openCHA will collect data from a food log and deep sleep information tracked by a wearable device, subsequently estimating the causal effects of nutrition on deep sleep. The response will reveal the nutrition effects on deep sleep, with values indicating the estimated average treatment effects of the nutrients per unit. We can also ask for food recommendations by querying the foods to improve certain health outcomes. For example, we say like, could you recommend me a food to improve my deep sleep duration? This will trigger the agent to execute the retrieve food task to obtain the relevant foods and their nutrition contents and personal nutrition effects. The response demonstrates the food suggestions to improve the deep sleep and the explanation based on the estimated personal nutrition effects. The recommendations are explainable. By querying with "Please explain your recommendations," openCHA will display the rationale behind the food choices, focusing on their nutritional impact. But what if you're missing an ingredient or food? No worries. openCHA's interactivity comes into play. Remember that this isn't just a static food list. It's a conversation with your dietary needs. Ask a follow-up question like, I don't have the recommended foods. What are my alternatives? And openCHA adapts, offering alternative suggestions. By calling the tasks, openCHA not only delivers nutrition-oriented food recommendations.
But what you saw here was like the agent actually had access to real data for this individual. More than 2 years, this individual wore an Oura ring, sleep was captured. This individual logged the food every day, all the meals. So the agent had access to all of that and could really build personalized models to see what, and also the agent can understand this person is asking a personal questions. He's or she's not asking like in general how people should improve their deep sleep. So he's asking how I can do it, right? And this actually is agent is clever enough to understand the personal questions is being asked, and now that it needs to plan and reason and trigger to retrieve data and do modelings. So, and this is actually very critical because agents now can bring, let's say, those cultural sensitive things into the picture, even if the LLM doesn't have that layer, or they can we can use them to put, guardrails around before or after data going to these LLMs. So there are a lot of opportunities, and also fact checking or triangulation from evidence can be done. Not just like a simple constitutional AI type of guardrails. Yeah, so with that, I would like to perhaps go back to my slide deck and see if there are any other questions, and I would love to take those questions.
Yeah, thank you so much, Dr. Amin. We are going to open up the floor to some Q&A questions. Are we saying wearables are helping pregnant women to do exercise, or are we saying AI responses help women stay and keep doing exercise during pregnancy in a safe way? And can this also extrapolate for cardiac patients as well?
The first part of the question, I think the benefit is more on the personalization part. The wearables actually makes the recommendations more personalized. In fact, in that study, we had multiple arms. One arm was we provided those kind of insights or actionable insights to a nurse in the loop to kind of communicate with and coach, provide like more human coaching. And the other one was directly giving it to the participants. And the results were almost comparable. I think the benefit, and both had were beneficial. I think the benefit is really kind of tailoring and not just one size fits all type of recommendations to everyone. That's how it works these days. You go to a doctor or kind of clinician therapist visit. Sometimes they print these many guidelines, and they hand it over all at the same time to you, rather than like having a step by step every day, every week type of navigating you or guiding you through it. And also it's generic advice that may not work for me. Maybe my culture or my kind of lifestyle is different. Maybe my environment is not safe enough to go maybe at 8 p.m. for a walk. All these things really need to be into account, and the personalization in this scenario to understand the person would really matter.
All right. Thank you so much for answering that question. Another question, a great question that came in, was how does openCHA attempt to infer causality versus correlation between sleep and nutrition? Like, for instance, some patients might eat more carbs when depressed or have poor sleep.
That's an excellent question. That's the reason why in this demo that I showed you, we call the causal model an external causal model. We didn't allow the LLM to just look at the association. So our lab is actually one of the groups that we do a lot of causal machine learning, building the causal graphs, looking at mediators, moderators. So we actually have this causal graph as an external source to the LLM. So that, as I said, the LLM, the agent can use external models, external knowledge, external data. And this was an external model that it could go and fetch and retrieve, apply the data and get the response back. Yeah.
All right, thank you so much for your time, and what a great presentation.